Okay, so we're in the OR. We are just finishing a body case, and we took some of the fat and harvested it with the same technique that we do for fat from the face. We're going to fat graft our hands. Why? Because as you get older, one of the signs of aging is that you can see the tendons and the veins in the hand because you lose fat. And so what we're going to do, you can see through this area, we're just going to replace some of that fat through some needle holes with these blunt cannulas. I'll show you in just a second. So once again, here's a cannula, and here's how we're going to be injecting the fat. Tiny little strands coming out the tip, like that, little strands throughout the hand. Okay, so there we go. You can see that the veins and the tendons are pretty well hidden. Now, a lot of that fat isn't going to take, which is good because she looks kind of swollen, but we'll know within a few weeks how much it is, and I've always been very happy with it. It probably take about 20, 30 years off her hands.